Welcome to my channel RX Sam 2020. Today, we discuss about drug Amlodipine. About is a calcium channel blocker medication used to treat high blood pressure and coronary artery disease. It is taken by mouth. Amlodipine works partly by increasing the size of arteries. It is a long-acting calcium channel blocker of the dihydropyridine type. Medical use. Amlodipine is used in the management of hypertension and coronary artery disease in people with either stable angina, where chest pain occurs mostly after physical or emotional stress, or vasospastic angina, where it occurs in cycles, and without heart failure. It can be used as either monotherapy or combination therapy for the management of hypertension or coronary artery disease. Amlodipine can be administered to adults and children 6 to 17 years of age. Calcium channel blockers, including amlodipine, may provide greater protection against stroke than other classes of blood pressure-lowering medications. Amlodipine, along with other calcium channel blockers, are considered the first choice in the pharmacological management of Raynaud's phenomenon. Combination therapy. Amlodipine can be given as a combination therapy with a variety of medications. Amlodipine with atorvastatin, where amlodipine is given for hypertension or CAD and atorvastatin prevents cardiovascular events, or if the person also has high cholesterol. Amlodipine with aliskiren or amlodipine plus aliskiren plus hydrochlorothiazide if amlodipine alone cannot reduce blood pressure. Aliskiren is a renin inhibitor, which works to reduce primary hypertension by binding to renin and preventing it from initiating the renin-angiotensin system (RAAS) pathway to increase blood pressure. Hydrochlorothiazide is a diuretic and decreases overall blood volume. Amlodipine plus benzapril if either drug has failed individually or amlodipine alone caused edema. Benzapril is an ACE inhibitor and blocks the conversion of angiotensin I to angiotensin II in the RAAS pathway. Amlodipine with celecoxib. Amlodipine with lisinopril. Amlodipine with olmesartan or amlodipine plus olmesartan plus hydrochlorothiazide if amlodipine is insufficient in reducing blood pressure. Olmesartan is an angiotensin II receptor antagonist and blocks part of the RAAS pathway. What is calcium channel blocker (CCB) are a group of medications that disrupt the movement of calcium through calcium channels. Hypertension, HTN or HT, also known as high blood pressure, HBP, is a long-term medical condition in which the blood pressure in the arteries is persistently elevated. Coronary artery disease, CAD, also called coronary heart disease, CHD, ischemic heart disease, IHD, myocardial ischemia, or simply heart disease, involves the reduction of blood flow to the heart muscle due to buildup of atherosclerotic plaque in the arteries of the heart. The renin-angiotensin system, RAS, or renin-angiotensin-aldosterone system, RAAS, is a hormone system that regulates blood pressure, fluid and electrolyte balance, and systemic vascular resistance. Dosage. For angina, chest pain. Adults 5 to 10 mg, mg, once a day. Your doctor may adjust your dose as needed. However, the dose is usually not more than 10 mg per day. Children use and dose must be determined by your doctor. Dosage for high blood pressure. Adults, at first, 5 mg, mg, once a day. Some patients may be started on 2.5 milligrams once a day. Your doctor may adjust your dose as needed. However, the dose is usually not more than 10 milligrams per day. Children 6 to 17 years of age 2.5 to 5 milligrams once a day. Your doctor may adjust your dose as needed. However, the dose is usually not more than 5 milligrams per day. Children younger than 6 years of age use and dose must be determined by your doctor. Contraindications: hypersensitivity. Special precaution: impaired liver function, impaired renal function, sick sinus syndrome, heart rhythm disorder, severe ventricular dysfunction, hypertrophic cardiomyopathy, severe aortic stenosis. Pregnancy unsafe. Pediatrics not recommended. Lactation unsafe, to be used if clearly indicated. Elderly reduced. Dose may be necessary. Common side effects: peripheral edema, abdominal pain, palpitations, flushing, low blood pressure, heart attack. Overdose. Although rare, amlodipine overdose toxicity can result in widening of blood vessels, severe low blood pressure, and fast heart rate. Toxicity is generally managed with fluid replacement monitoring ECG results, vital signs, respiratory system function, glucose levels, kidney function, electrolyte levels, and urine output. Vasopressors are also administered when low blood pressure is not alleviated by fluid resuscitation. Mechanism of action on blood pressure: amlodipine is considered a peripheral arterial vasodilator that exerts its action directly on vascular smooth muscle to lead to a reduction in peripheral vascular resistance, causing a decrease in blood pressure. Frequently asked questions: what is the half-life of amlodipine? Amlodipine is an oral dihydropyridine calcium channel blocker. Compared to nifedipine and other medications in the dihydropyridine class, amlodipine has the longest half-life at 30 to 50 hours. The benefit of such a long half-life is the ability to have once daily dosing. Why amlodipine is taken at night? New research suggests that taking your blood pressure medication at bedtime may more effectively reduce your risk of illness or death due to heart and blood vessel disease. Timing of medication is important because blood pressure follows a daily rhythm. It rises higher during the day and falls at night when we sleep. How quickly does amlodipine lower BP? Calcium channel blockers start working within 2 to 4 hours of taking the first dose, but it can take 3 to 4 weeks for the full effects to kick in. Is amlodipine hard on the kidneys? Amlodipine and lisinopril should not cause kidney damage and in fact are used to treat high blood pressure and slow the progression of chronic kidney disease, CKD. Some brand names which are available in market: Amlopin, Stamlo, Norvasc, Amlopres. Thanks for watching. Please subscribe, like, share and comment below.